Okay, so welcome. It's good to see you today. I think it's been maybe a year and a half since I last saw you. How have you been? Good. Oh, I'm pleased. So all going well then. That's what I like to hear. Well, thank you for coming in today. This is just a very routine checkup, okay? So, are you happy for me to examine you today? Wonderful. Be nothing difficult. Really, really nice, simple examinations, okay? So, I will listen to your lungs, check your breathing, check your heart rate. I'll do a little bit of a skin examination just to check for any lumps or bumps or redness, anything like that. We'll just do a little vision test as well, but as I say, nothing too taxing for you. Okay? Lovely. Well, before we begin, I just need to make sure there haven't been any changes in your notes. Okay, so I've been looking through. Can I just confirm you still have the same name? You do. Lovely. And are you still living at the same address? Perfect. Is your telephone number still the same? Great. Is your email address still the same? It is. Lovely. Okay then, that's all good. And just of course to do with new practices and whether we can contact you or not, are you happy to still receive our monthly newsletter? You are. Wonderful. Okay then, and would you be happy still, to receive communication via text or via post? Just in case, for example, we send you out a letter when you need your flu jab, things like that, but we can text you instead or do both. Just the SMS. Okay, perfect. Lovely. So that's all the routine stuff. Now on to any changes in health. Okay, so have you been unwell during the past 16 months? Maybe? Could be 16, maybe 18 actually. How have you been generally? Okay, so the old kind of cough and cold. Sure. So no major illness? No. Good. General coughs and colds. I haven't got down any antibiotics for you, so unless you went to another surgery, did you just self-medicate with those? You just went and saw the pharmacist. That's great, no problem. I'd rather my patients go and see, at least their pharmacist rather than just look up things online. So that's good that you sought advice for that and you were able to get over them. So that's really good. It's probably the best thing because really, for anything viral, we don't recommend giving antibiotics anyway. Unless you're, on death's door really. For coughs and colds, it's best just to really try and fight the virus with over-the-counter medication and just build up a bit of your resistance. Really, I would honestly say just to try and avoid them. They really weaken your immune system, so unless you've been off work for a week or more and it's really debilitating, then I wouldn't say, you really need them. Okay? Lovely. So no changes then to your regular medications? No? Getting on with them all right? Good. I know you have tablets for migraines. Yeah, you're getting on with those all right? Good. Okay. You still got your repeat prescriptions. Lovely. Don't need to issue any more. Okay then. Now, do you have any issues that have been bothering you? Okay. And where do you have that sensitivity? Just around here? Okay. How long would you say you've had that? Just trying to think. That does tie in the change in weather. Can have a big effect on the skin. Okay, I do notice you do have a little bit of redness, so I would have looked into that anyway. Anything else at all that's on your mind? Bless you. Well, our height measuring is one of the things we were going to do anyway, so you're convinced that you shrunk a little bit. Okay, I'm sure you haven't. But let's take a look at that first then. We'll do your height and your weight. Okay, so if you'd like to just step over there to the height machine, please. Okay, just remove your shoes for me. Oh, it's handy you got slip-on ones. Yeah, oh, honestly, when people come in with laces, I think, you're just going to get frustrated. I know. Okay then, hop on the machine for me, and if you just press the red button by your right foot. Lovely, just turns on the electronic read up there. Stand nice and straight as if you're being pulled up by a string. Lovely, and step off for me. Leave your shoes off just for a moment. And let me check. Nope, you are the same height. You are. Alright then, if you could step on the scales for me. Lovely. Let's have a quick read. Okay, and step off. You're welcome to put your shoes back on. Let's compare that. Okay, you've lost around 3 pounds. Oh, wonderful. Okay, so you've decided to become a bit more active. Great. Well, that's always good because you're within a very healthy BMI, so that's perfect. Very well done. Always like to keep an eye on weight management, just because, we look out for any unexpected causes of weight loss, but that's fine if you've actively been seeking to do that. Make a note of that. Okay. Right then. So height and weight are done. BMI range. Very good. Lovely. So what I want to do now is I would like to check your heart rate. Okay, so I've got our little machine. Alright, we actually just got new ones of these today, so to order some new ones in. So let me just get this out. Now, when someone has changed their lifestyle in a positive way, we'll often see a better reading with these. Okay, so let's place this round your arm then. Okay, so if you could just roll your sleeve up for me. Either arm. Okay. Alright, and let's place this round. Lovely. Now if you could just sort of just hold your arm like this. Let's turn it on. Lovely. And okay, just give it a moment. Don't worry, it will just tighten up. Okay, and just nice and calm. Okay. Lovely. Can pop that back in the box now. It's a very good reading. So let me just make a note of it and compare it with your last reading. Okay, so 1 over 2 compared to, very good, very nice improvement. Shows me that you've been getting nice and fit and healthy. Wonderful. So now all I'm going to do is I'm actually going to take your temperature. I am, just to check, sometimes even if you feel okay, a temperature can be a sign of maybe something underlying. So I'm just going to take that quickly. This is the ear thermometer. Okay. So let's get this out now. We normally didn't used to do all of these checks, but some new guidelines have come in, so we do have to do them. Okay, so that's alright. Just come round to the side of you. Place that on. Get a reading. Wait for a moment. Lovely. Okay, all normal. Right, place that back in there and note that down. 0.8. Normal range. And do you feel well today? You do. Good. Well, you look very well. Okay. So now we are on to the skin part of the examination. So I'm going to pop on some gloves. These are latex free, alright, just in case you have an allergy. We have decided to just go latex free with them. So these have just come out of a fresh box from the cupboard, but they're not actually too cold, so always good. So, okay, so nothing to worry about. All I'm going to do is just do a quick observation of your face. Now, this is an optional part, okay, but if you would like me to examine any moles, anything that you're a little bit concerned with, we can also do that now. Yep, and where is that? Oh, okay, that's fine. So just a little bit concerned here and a little bit here. No problem. So, would you mind then just removing your top? Is that okay? Or if not, we can just move it down slightly. Lovely, okay. Let me place that over there for you. There we go. Alright then. So, let's just have a little look as they're concerning you first. So just this one just here. Okay. So it's not an irregular shape or colour or size. Let's just have a little feel. Let's just close my eyes whilst I do this. Okay, let's have a look at the other one just here. Okay. I'm just going to get a little glass. Okay, this will be a little bit cold, alright? I'm just going to hold this glass just over, yeah, and just over this one. Yeah, okay. So let's place them down. So, to me they look completely normal. Okay, it's very, very healthy that you've decided to bring those up for me today. Any changes in any existing moles or spots, anything like that, it's really good that we do just, be proactive and, let doctors know. But I can't see any causes for concern. As they are new, we do actually get moles and various things popping up for no reason sometime, okay? The important thing is that we keep an eye on them. And what I recommend to do to all my patients is just to take a picture on your phone. Take a picture, the date will already be on your phone, and then take another picture a month later. And it just gives you a nice little reference. If there are any changes, then we can monitor them. Okay, now I decided to place a glass over them because often it's a little bit of an old wives' kind of trick. So you place a clear glass over something, and if it nearly to almost disappears, it's likely that it's okay. Alright, now this one here, just on the shoulder, all I would say is if you're going to be out in the sun, especially during the summer months, or if you're going on holiday, just put a little bit of extra sun cream on that. This one as well, but just on this one because the shoulders are an area that burn quite easily on a lot of people. But again, no causes for concern there. They're both of a regular shape, colour and size, and they feel normal under the skin. So that's really good. Okay, lovely. Wow. Let's have a little look then at that face. Okay, so are you wearing anything on your face at the moment? Perfect. Okay, that's really, really handy. So let's have a little look then. So all I'm doing to start with is I'm just feeling the texture. Got a little bit of a spot just coming under the skin there. You can feel that, yeah, just a little bit. Okay, let's have a look up here. Okay, just in between here, I don't like to ask this question to patients, but sometimes it can be a result of a certain procedure. Now you look fantastic, so I don't think you need this, but have you had any sort of Botox or filler in this area? Okay. Yeah. No, that's alright, that's fine. The reason why is because sometimes you can notice that it becomes a little bit fatty feeling, and that will go down. It's just normally I notice it within the first couple of weeks. Obviously, you know, I don't specialise in that area, but we are made aware of these types of things, so that's fine. That's fine. Did you get it done at a licensed practice? It was done by a nurse. That's fine. Okay, you've not had any problems with that? No. Good. Right. So I think the rest of the skin is feeling okay. Just gonna feel underneath your glands as well. They feel fine. Down the neck. And I'm just gonna feel just around this area. Okay, just let me know if you have any pain or tenderness anywhere whilst I'm doing this. Just here? What about if I do this? Yeah? Typically that will stem from neck pain. Just getting the pain just in that little muscle, just coming down towards the shoulder. So do you tend to, when you're looking at your device, do you tend to perhaps sit more towards this side when you're looking at it? Yeah, so generally that twist has caused probably a bit of a tear in this area. I would normally recommend the use of ice or a cooling pack or gel on that area, just to try to reduce the inflammation. You can use heat if you find it relaxes you and the muscles. It's just a personal preference. I think that the ice tends to reduce a little bit more, but I can't feel anything unusual under the skin. Just be from that muscle. Okay, let me have a quick look at you. Observe your posture. Your posture actually goes down a little bit like me on one side. I also suffer with back and neck pain, and I have actually been to a chiropractor who recommended that I actually wear a lift in one side of my shoe. So it kind of raises me up on one side. You can pick them up in local pharmacies, things like that, shoe shops even. Okay, and just hold your arms out for me. And whilst you're doing that, could you lift one leg for me? And put it down, and the other leg. Good, and put that down. Lovely, and hold your arms out in front of you. Lovely, and above you. Great, okay. Alright, balance looks good. That's what we like to see. Okay, so this redness just here and a little bit here. Is it itchy at all? Is it just in that area? Okay, let me have a look at your hand. Alright. I can see it's quite dry, isn't it? In between, especially the fingers. Are these your natural nails? Okay, no, they're in good condition, so that's quite a good sign of health, though. That's good. Okay, there is a bit of redness, so it's difficult because it could either be something like mild eczema, okay, in which case I can prescribe to you a cream. You can also pick things up yourself in pharmacies, or I would say that it is just a case of skin dryness, aggravated by the cold weather. So dry skin can cause itching and redness. Typically, when they're just in small patches like this, I would recommend maybe just using a really good moisturiser. Now, I would personally, unfortunately we don't prescribe it, but I would recommend trying to get a cream with urea in. It's your best bet really, because it is very, very moisturising. You want to really, it's difficult in this country. When I was in Poland for work, I picked up some urea creams that had 20% in. In this country, we tend to get between 2 to 10%, a lot lower, but you can pick it up fairly inexpensively in a lot of different shops. So I would say apply that morning and evening to the hands as well. Are you using any type of hand sanitizer? You are. How regularly do you apply that? Right. So I think they're great, especially this time of year. Maybe you don't have gloves on as well. Not everybody does, especially when you're shopping inside. So in that sense, they're really great at protecting you from 99% of germs. However, they can really dry your hands out and your nails. So all I would say is, if you've been using them during the day, just make sure when you get home, or maybe in the middle of the day, apply some moisturiser. Okay? Great. You can also buy moisturising gloves that you could wear at night, so that should help. But generally during this area, I wouldn't say it's really a skin condition. I would expect to see it a little bit redder if I was going to think it was eczema. But let's monitor it, okay? If you're at all concerned, come back in and have a little chat with me in a couple of weeks. Okay? Perfect. Alright then, let's have a little listen, alright, to your chest just before you pop your top back on. So, any difficulties or changes in breathing? All fine. Alright, let's have a listen then. Oh dear. So just breathe in and out. Breathe in and out. Breathe in, breathe out, and turn around for me. And breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Okay, and turn back around for me. Lovely, all sounded completely normal. Alright, so let me just make a couple of notes. Alright. firstly breathing normal. Lovely. And right, so moisturiser review in 2 weeks. So I'll wait for your call, alright? If you have any issues before then of course get in touch. But if not, if there's any issues at all with the skin, give me a call in a couple of weeks. I'll get you back in and I will prescribe you some cream. Okay? So review in 2 weeks. No signs of jaundice of the skin. Looks a nice healthy colour. Got a nice healthy glow. Alright. So let's do a little, just very quick sight test. I'll also just take quickly a look in your eyes. So let's have a look in your eyes first. I am going to shine a little torch. Alright, so look straight ahead for me. Good. Any changes in your vision? No. Any dizziness, blurriness, unusual headaches? No. You wear computer glasses, don't you? You've been wearing those. Do you think your prescription is still fine? It's very mild, isn't it? Yeah. Lovely. Okay. Pupils seem to be reacting normally. Good. Lovely. Eyes look nice and healthy, reacting as normal. So I just want to do a couple of very, very quick tests. Okay. So, can you please tell me when this goes out of sight? Okay, so you can either look at my nose, you can look straight behind me, look at my glasses, whatever you like. And all I want you to tell me is when it goes out of sight. Okay, let's start with one finger. Good. 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 Very good. Good. Well done. Let's try it now with 2 fingers, okay? So only tell me when both fingers disappear from your view, okay? Good. Good. Very good. Good. Do a couple more. Good. And the last one. Perfect. Very, very well done. Now, there is a couple of other tests that we could do with the eyes. However, if I'm honest, I think your eyes look in good health. So we're going to leave it at that for the eyes. But what we are going to finish with today is just a little bit of a hearing test. Okay? So, what I'd like you to do is you'll notice on the floor I've placed a little gold star. So, could you just stand on that gold star for me? Wonderful. Okay, so all I'm going to do is I'm going to whisper some words. Okay, so I want you to close your eyes and I'm going to whisper some words and then you just have to repeat them back to me. Okay? Understand? Perfect. So just close your eyes for me. Alright, here we go. Doctor. Good. Protractor. I know I can say it again, that's fine. Protractor. Good. Water bottle. Good. Microphone. Excellent. Christmas tree. Good. Ukulele. Very good. Just a couple more. Drum kit. Good. And the final one. Glasses case. Good. Okay, you can now open your eyes. Well done. Very, very good hearing. Just come back to me now. Lovely. So, we are all finished for the day. We are. Let me just review my notes. Okay. So, no causes for concern. We have done all of the basic checks. Patient seems to be in good health. I'm very pleased. We have done vision and hearing checks. Tick, tick. We've done that. Check, check. Also done this. Tick there, tick there. Okay, wonderful. Just sign this off. Perfect, and that will be inputted into the system. Alright, let's place that down there and just take my gloves off. Okay, here is your top. Let's pop that on you. Sure, you're getting cold. That's a very nice top though, I have to say. Lovely. I need to get out my festive jumpers. I do. Oh, let me help you. There you go. Wonderful. Well, I hope you've found today nice and satisfying, that you're in all good health. Good, and I've given you peace of mind about those. Wonderful. So then, really my only bit of helpful advice for you today, as you're in such good health, is just to add a little bit of moisturiser to there and your hands. Okay? Perfect. Alright then. Well, unless you have any questions, then we are finished for the day. Absolutely no. Don't worry if you can't get anything with urea in. It just so happens that it is extra moisturising. You will find it actually in quite a lot of foot creams, especially ones for dry and cracked heels. So if you find a foot cream, there's nothing wrong with using that on your hands. Okay? Perfect. Alright then, will you enjoy the rest of your day? Any other plans? Ooh, lovely. I know. Oh well, I have a few more hours to finish up here. I do, but I'm very much looking forward to a hot chocolate when I do get home. Absolutely. I'm going to sit in front of the fire and feel nice and cosy and warm. Perfect. Alright then, will you enjoy the rest of your day? Sounds wonderful. And I may or may not hear from you then in a couple of weeks. No, that's fine. If we don't hear from you, then I'll assume that you're fine. Alright? Lovely. Well, I will see you again then in around a year. Let's try and keep it, if we can, to, a yearly kind of check. I know things get busy and changed around, but it's just a little bit easier to keep track of. Alright? Perfect. Alright then, I'll see you in a year. Alright, bye then. Alright. Teeth through. Those gloves away. Let's start decorating this office actually. I've got some tinsel left over at the surgery last year. Am I going to have a little surgery? I don't think. Got another appointment for about half an hour actually. I think I can do that.